That leads me onto the types of grants. There are three main types of grants. There could be others. There is research grant, which you can access to do research, and there's also training grant, where you can access some money, you don't have to pay back, for you to do either undergraduate studies or postgraduate studies. I know certain medical students in their final year who are on scholarship from Shell Petroleum Development Company. So they're able to train for a degree, or a postgraduate degree, by accessing such training grants. I had one student in my group whom I supervised. I don't have to mention his name. He was on, or he's still on, scholarship from Shell Petroleum Development Company because he comes from the Ogoni land. I'm sure there are scholarships for people who come from such places. There is also travel grant. And this means that if you have to attend a conference to make a presentation, you can apply to get a travel grant. I remember when I traveled to India, in Kolkata, India, to attend the World Congress on Public Health, WCPH, World Congress on Public Health, in 2015 in Kolkata, India. I met some medical students who came for that conference. They came to do poster presentations. Some of them funded themselves, perhaps because they had well-to-do parents, but the majority who attended got travel grants somehow, maybe full grant or partial grant, to attend the conference. So what I'm saying is this: even as a medical student from the University of Calabar, you can attend conferences within Nigeria and outside Nigeria by applying for a travel grant. You can apply for a training grant to get scholarship for you to train. You can also get grants to do research, even as a medical student. And when you access these grants, you do your research, you are contributing to nation building. So I encourage every medical student in the University of Calabar to seek ways to access some of these grants, even while you're in school. Like I said earlier, there's many sources of grants. Local sources, for instance, the federal government and the state governments can provide scholarships to students who come from those states to study or to do research. I just talked about Shell Petroleum Development Company. International sources, there are bilateral agencies like the United States Agency for International Development, and the CDC, Atlanta, Georgia. There's the Department for International Development, UK. There's Commonwealth. There's International Development Research Center, Canada. All of these bilateral agencies provide scholarships that one can access. What I mean by bilateral agency is that government in a rich nation or in a high-income country provides money, and then such monies can be used to support people who come from low-income countries. That's what I mean by bilateral. That's bi, meaning two, talking about two governments. A high-income country and then a low-income country. There's also the multilateral organizations that can provide grants, research grants. There's the World Health Organization, the World Bank, the UNICEF, the UNDP. Multilateral means that you have different countries pooling resources together and making these resources available for people to access to do research through grants writing. There are other foundations, still talking about international resources. There are foundations like the Rotary Foundation that can provide research grants for people to access. Still on international sources, there are universities abroad that one can apply to get a scholarship to study and also to do research. So there are steps. One of the slides talks about 4 steps that one can take to search for grants and apply for them. But I'm not going to go into those details. Now I'm going to share my experiences with you. It's not because I'm the most competent person in the area of multidisciplinary research or collaborations, I'm not the best person to talk about this. There are mentors who have done very well in this area, but I'm going to share my little experiences in a way that they relate with or resonate with students in the University of Calabar, medical students. By the special grace of God, I'm a double doctor. I have MBBS and a PhD.
Oh, that's amazing.
By the special grace of God. What I want to say is that one of these 2 degrees was funded. I got a scholarship to study for my PhD. The scholarship was awarded by the National Institutes of Health, Fogati, USA. What they did was to pay my tuition fee to study for my PhD. They also made available for me a certain amount of money to do research. And in this research, I collaborated with people from different disciplines. This is postgraduate. It's also possible for undergraduates to access research, access funds through grants to do research, just to let you know it's possible. But I enjoyed a lot. I mean, paid my tuition fee, paid me monthly stipends. Every month I had money to spend for my upkeep, and they also made money available for me to do research. So I'm done with being a double doctor. I have double master degrees, MPH, and Master of Medicine in the field of epidemiology. This was also funded by the WHO, World Bank, UNDP, UNICEF. The same thing. They flew me from Nigeria to study abroad and flew me back to Nigeria. They paid my tuition fees, paid me monthly stipends, and they paid also for my research. They paid for me to go to Ghana to do my research. They funded my research. I'm also a double fellow of the West African College of Physicians and fellow of the Medical College of Public Health. However, none of this was funded. So, in the slide, I have emboldened 2 degrees that were funded, PhD and then the MEd, Master of Science in Medicine in the field of epidemiology. So, these are the degrees that I have by the special grace of God. How many of them? 6 of them. 6 of them by the special grace of God. Now let me talk about collaborations, my experiences. I am a visiting scholar and scientist at the Harvard School of Public Health in Boston, Massachusetts, USA. I have collaborations with the Department of Global Health and Population at the Harvard T.H. Chan School of Public Health. We are working in the area, we're collaborating in the area of doing a multidisciplinary research in the area, for instance, more specifically, providing quality and affordable care to vulnerable populations. This is one area we're collaborating in. I don't have to pay. I'm not taking this money from my pocket. It's a grant that I've been able to access to do research, multidisciplinary research. I'm also collaborating with the Brown University, USA, where we're looking at the possibility of researching in the area of health and social changes in Africa. I also have collaborations with the African Population and Health Research Center in Nairobi, Kenya. This group also funded my PhD research. And just about 4, 5, 6 weeks ago, they funded my trip to Dakar for a meeting to make presentations in a conference. And of course, they have funded me in the past 3 to 5 times to travel to Nairobi, Kenya, to work with them, to have meetings with them. I also have collaborations with the University of the Witwatersrand in South Africa in the Non-Communicable Disease Leadership Program. And this was the university where I did my PhD and my master's degree. While I was studying for my PhD, I was on Postgraduate Merit Award. This means that my master's degree grades were good enough for the university to fund my PhD. So I was on multiple scholarships and grants when I was a PhD student. I had a good time, a really good time. And I want to let you know, as a medical student, you also can have such good time if you are properly mentored and somebody can guide you properly on how to seek such grants and apply for them. I have had trips funded, talking about travel grants now. My doctoral research, the findings were presented in 16 international conferences. All of them were paid for. 16 funded international conferences. They flew me from wherever I was to another country, flew me back, they lodged me in a hotel, they paid me per diem just for me to do either an oral or poster presentation. These are funded trips, travel grants. However, when I finished my PhD, when I completed it and I came back to Nigeria, I wasn't able to make 2 funded trips because the embassies felt I wasn't going to come back. You know, they have these stereotypes about Nigerians, and Nigerians want to travel and they don't want to come back to Nigeria. Unfortunately, that may be the case for many Nigerians, but there are a few Nigerians like me who love my country and want to stay back to build my nation through multidisciplinary research. Other than those 16 funded conferences, I had attended 10 meetings funded, trips paid for, hotel reservations made, per diem paid, just to be in a meeting. All of this made possible through accessing travel grants. The last of them all is publications. I've had some of my PhD PhD papers published. 5 of them, in which I'm the first author, have been published. I didn't have to pay a dime for the article processing charge or the article processing fee. It will interest you to know that the lowest amount that was paid for my articles, the articles in which I was the first author, was $1,582. And the highest amount was $3,300. That's about 1.2 million naira. Just to publish an article. I didn't have to pay a dime. So these things are possible. I also have other papers that I'm not the first author that were published, and we didn't have to pay a dime also because those publications were funded by international agencies. I have a slide on the centers I collaborate with. If you look at the slide number 20, you will see that there are stars and arrows from Africa, which is my base here in Nigeria, to North America, to Asia, to Europe, and then within Africa, I have collaborations in Ghana, in Kenya, and in South Africa. So that slide really gives a sense of who and where I'm collaborating with. I'm really grateful to my funders, the National Institute of Health for Gati, the Harvard School of Public Health, the African Population and Health Research Center, the In-Depth Network, for all of the fundings that have been made available to me. So I'm going to conclude now. And the conclusions are: